Continuing on with interdisciplinary team intervention to be able to fight cancer. I'm going to share my screen. I had just left off about chemotherapy, and I'm going to start talking about radiation. So radiation, there's a few different ways that we can use radiation to the client's benefit. There's external beam radiation, where the patient is exposed, like you see here in this picture, to radiation from a megavolt machine. There are some different types of radiation. So there's gamma knife technology, there's cyclotron, which uses neutrons or protons, and then there's a linear accelerator, which uses an ion radiation therapy. But this person here that is on the table is getting an external beam radiation. There's also brachytherapy, and brachytherapy is what I was talking about when I was talking about the radioactive seeds that are about the same size as flax seeds or sesame seeds. And so they get implanted or inserted into different tissues close to or into the actual tumor. The nice part is that minimizes the exposure to healthy tissue, and it can be used in combination with external radiation therapy, especially for prostates. They'll use a combination of external and internal, otherwise known as brachytherapy. People who are getting external beam therapy, what you don't see in this particular person, they're getting radiation to somewhere above the neck. I'm not 100% sure where. But what you will have is these people will commonly have little tattoos that line up with specialized mask markers. Like this netting is not just like regular tuba grip netting. This is probably an actual specially formed mask to that person's face and head and shoulders. And so they are actually like locked into place, because even the smallest shift will cause that radiation beam to go into the wrong spot. And the radiation beam, if it's not damaging the tumor, it's damaging normal tissue. So we need to have that person in the exact right spot, like down to millimeters. A millimeter is the width of a paperclip wire. We need to have that down that person in a very specific spot so that we can aim that very specific beam in such a way that we don't damage any normal tissue as we're trying to destroy the cancer tissue. And so people will sometimes even have little tattoos about where their I don't want to call it a confinement device, but where their therapeutic device is going to be placed, so that way everybody on the team knows 100% where that that device goes to be able to restrain or withhold that client from moving. So sometimes you'll see like little tiny dots, and that's markers for where different things need to be, they line up with their different restraining devices, I guess is the best way I can think of it. Immunotherapy is a way that we can do two things. It attacks the cancer cells directly, and it boosts or manipulates the immune system to create an environment that's not conducive for cancer cells to grow at all. So we can either change the environment through immunotherapy, and or we can attack the cancer cells directly. So it's a very specific targeted therapy that works in such a way that we have less friendly fire damage. Chemotherapy has a lot of friendly fire damage. Remember, it affects skin cells, gastrointestinal lining cells, bone marrow. Immunotherapy will have less of those impacts because it's really retraining, repurposing, tweaking the immune system of that individual to be able to enlist the help in the person's own immune system in the cancer fight. Hormone therapy, you can use, there are different hormones that can either enhance or stop the growth of cancer cells. So like estrogen and progesterone, just to let you know, enhance the growth of some breast cancers. And testosterone can enhance the growth of some prostate cancers. So we can give certain hormones to block the effects of the sex hormone to be able to stop the growth of cancer cells. A lot of people will be getting corticosteroids in combination with their drug regimens to help curb the side effects of their chemotherapy or their radiation. So it's not uncommon for a person to be on steroids while they're going through chemo and radiation. And in addition to manipulation of hormones, some surgical interventions can be used to remove the effects of the hormone on cancer growth. So we can have an oophorectomy, a removal of the ovaries. We can have a removal of the testicles, otherwise known as a castration, to help remove the effects of that hormone on the cancer growth as well. Hematopoietic therapy, hematopoietic being blood. We can do a few different things. We can do growth factors, which is a colony stimulating factor. So basically that's a protein, a glycoprotein that stimulates production and activation of cells in the hematologic system. It can help people recover faster from bone marrow depression. It helps bone marrow reestablish function. Maybe they're getting some really, really strong chemotherapy. They may also be getting growth factors, colony stimulating factors to be able to help that bone marrow recuperate or minimize the effects of the chemotherapy on the bone marrow. Let's say the cancer is in the bone marrow. We may end up doing some chemotherapy to completely obliterate the bone marrow itself. And then these people will still need marrow from something. So they can get a bone marrow transplant. They can also do a peripheral stem cell transplantation. And then the stem cells can be, the stem cell transplantation can be useful for two different ways. So it's used for high doses of radiation and chemotherapy. And it's also used for, like I said, for people who have bone marrow cancer. But if a person has some really, really stringent, stiff, intense chemotherapy, their bone marrow is going to be impacted and their bone marrow may be completely obliterated by that chemotherapy. So we may do, after we're done with chemotherapy or at the end of chemotherapy, we may be doing some stem cell transplantation to replace the bone marrow we accidentally killed off because of the treatments that we were giving. There are also people who will, if they've got a really stubborn cancer, the cancer may develop resistance to therapies. And then we have to really amp up the high dose of the high dosage treatments. And whenever we're ramping up the high dosage treatments, the client's at huge risk of losing their bone marrow. The only way to get bone marrow back is to do a bone marrow transplant or a stem cell transplant. We can either get that stem cell from someone else through a donor, or we can get it from the cancer patient themselves. So an autologous stem cell transplant is, let's say for whatever reason, we have an understanding that that client is going to need some major chemotherapy and radiation. And we know that it's going to be either a high risk of, or it's almost guaranteed that that person's going to lose their bone marrow because of the amount of stuff we're giving them. What we can do is, before we start, is harvest some stem cells or some bone marrow, and then treat them with, and we'll kind of do like a scrubbing, so to speak, and we'll scrub any malignant cells that might happen to be in there. And then we can actually do an injection of those purified stem cells back into the client, and then the stem cells go and repopulate the bone marrow to produce new blood cells. So the nice part about an autologous stem cell transplant is that you don't need to have any sorts of anti-rejection meds because it's the person's own stuff that we're just re-injecting after it's been scrubbed a little bit. And while we're scrubbing the malignant cells and not harming the normal cells in the lab and the test tube, the patient's remaining bone marrow and cancer cells are destroyed through the chemotherapy and radiation processes. As for gene therapy is pretty experimental still at this point in time, but the genetic materials are actually inserted into the DNA to help fight the disease. And it's really in trial phase right now. So I don't have a huge amount of information about this therapy. It's out there, it's advancing. Who knows, maybe next year I'll have like this really robust slide presentation to be able to talk about gene therapy. At this point in time, that's just not in the works. I'm going to stop sharing. So this was a series of interdisciplinary team intervention explanations for cancer treatment. Like I said, a lot of people who are working with oncology patients, it's definitely a team effort. So, and it's not just a team effort from the psychosocial perspective, but it's a team effort from within a variety of different disciplines too. So I'm going to stop sharing here and then we'll talk about nursing management next.